You're walking down the hallway, or simply turning your head to back out of a parking space, when a sudden wave of sheer terror hits you. The room begins to spin. The floor feels like it is tilting beneath your feet. A heavy wave of nausea washes over your stomach, and you have to grab the nearest wall just to keep from falling over. You go to the emergency room, terrified that you are having a stroke. The doctors scan your brain, check your heart, and tell you everything is normal. They send you to an ear, nose, and throat specialist who diagnoses you with vertigo. For the next 6 months, you take anti-dizziness medications that make you exhausted. You perform repetitive head-tilting exercises to clear out crystals in your inner ear, but nothing works. The constant floating dizziness remains, accompanied by a deep, tight ache in the back of your head and neck. If this is your reality, you must listen very closely. You are trapped in a medical blind spot. Your inner ear might be perfectly healthy. You are likely suffering from fake vertigo, a highly disruptive mechanical condition known as cervicogenic dizziness. Today, we will explain exactly how a hidden injury in your neck is hijacking your brain's balance system. To understand why your neck is making the room spin, you must understand how human balance actually works. Your brain maintains your physical balance using a highly sophisticated 3-part biological GPS system. The first part is your eyes, which provide visual data. The second part is your inner ear, which detects gravity and rotation. The third, and most frequently ignored part, is the proprioceptive system in your cervical spine. Your upper neck is packed with millions of microscopic sensory receptors. These sensors are deeply embedded in the thick muscles at the base of your skull and inside the capsules of your upper cervical facet joints. Their job is to constantly transmit real-time data to your brain, telling it exactly where your head is positioned in physical space. In a healthy body, the eyes, the inner ears, and the neck sensors all send perfectly matching data to the brain. But what happens if the upper neck is mechanically damaged? If you have severe chronic muscle spasms, arthritic inflammation, or microscopic ligament damage in your neck, those sensory receptors become inflamed and corrupted. They begin sending frantic, chaotic, and incorrect positioning data up to the brain. Suddenly, your brain's GPS system crashes. Your eyes say your head is standing still. Your inner ear says you are standing still, but the inflamed sensors in your neck are screaming that your head is rapidly tilting or rotating. The brain cannot process this conflicting information. It triggers a system error. That system error manifests as intense dizziness, unsteadiness, visual blurring, and extreme nausea. This complex neurological overlap exposes the massive flaw in how modern medicine treats dizziness. When a patient reports feeling off balance, general doctors immediately default to diagnosing benign paroxysmal positional vertigo, or BPPV. This is a condition where tiny calcium crystals in the inner ear become dislodged. To treat it, doctors perform the Epley maneuver, rapidly tilting the patient's head to move the crystals back into place. If your dizziness is actually caused by damaged sensors in your neck, violently tilting and rotating your head to fix a non-existent ear problem will severely aggravate your cervical spine. It acts like pouring gasoline on a fire. The violent twisting triggers even worse muscle spasms, making your fake vertigo instantly more severe. Furthermore, prescribing heavy vestibular suppressant medications like meclizine or betahistine does absolutely nothing to heal a damaged spinal joint. You are simply sedating your central nervous system with chemicals to mask the symptoms of a mechanical neck injury. You cannot fix a corrupted electrical wire in your neck by dropping medicine into your ear. We cannot separate true inner ear vertigo from cervicogenic dizziness by guessing. We must act as elite medical detectives. The diagnosis relies on isolating the mechanical triggers. We look for a very specific clinical pattern. Does the dizziness intensify when you physically turn your neck rather than just moving your entire body? Does the dizziness arrive alongside a severe, stiff headache at the base of the skull? To find the objective truth, an elite neurosurgeon demands a high-definition magnetic resonance imaging scan of the cervical spine. We are looking for structural triggers. Has a degenerating cervical disc collapsed, causing the facet joints in the upper neck to grind together and become inflamed? Are there severe asymmetrical muscle spasms crushing the sensory nerves? We also utilize specialized dynamic X-rays, taking images while the patient bends their neck completely forward and completely backward. We must ensure that the upper two vertebrae, C1 and C2, are not loose or unstable. If the upper cervical spine is wobbling abnormally, it will constantly irritate the surrounding neurological sensors. In our clinic, the most common historical trigger we find for this condition is microtrauma, specifically whiplash. You do not need to be in a massive, high-speed car accident to suffer a whiplash injury. Even a minor rear-end collision, a sudden fall, or years of aggressive text neck posture can create tiny microscopic tears in the deep ligaments and muscles of the upper neck. When these tiny tears heal, they form rigid, inflexible scar tissue. The body reacts by locking the neck in a state of permanent muscle spasm to protect the injured area. This is a condition we call Cervico-Cranial Syndrome. The chronic, unrelenting tension at the base of the skull restricts normal blood flow and continuously crushes the delicate balance sensors. The patient is left with a heavy, throbbing headache that wraps over the top of the skull, accompanied by unpredictable waves of dizziness and profound visual fatigue. Because cervicogenic dizziness is a mechanical and neurological problem, our treatment protocol is highly targeted. We do not prescribe sedating dizziness medications. Our primary objective is to reboot the sensory receptors by shutting down the physical inflammation in the upper neck. If the MRI proves that the upper cervical facet joints are inflamed and sending false signals, we utilize highly precise X-ray-guided diagnostic joint blocks. We inject a microscopic drop of specialized anti-inflammatory medication directly into the exact microscopic joint capsule in the neck. If the patient stands up and their chronic dizziness instantly clears, we have undeniably proven the source of the short circuit. Once confirmed, we can employ advanced physical therapies specifically designed for cervical proprioception, retraining the neck muscles to send accurate data to the brain. If the inflammation is caused by a herniated disc compressing a deeper nerve structure, we bypass massive open surgery. We use ultra-minimally invasive techniques such as laser decompression or endoscopy to gently relieve the physical pressure inside the spinal canal, allowing the nervous system to finally calm down and heal. Living with chronic, unexplained dizziness is a psychological nightmare. Many patients stop driving their cars, stop going to the grocery store, and become prisoners in their own homes because they are absolutely terrified of falling in public. They accept this shrinking life because an inner ear specialist told them there was nothing more to be done. But let us look at the true cost of accepting a mystery diagnosis. If you ignore a chronic mechanical failure in your cervical spine, the joints will continue to degenerate. The muscle spasms will become permanent scar tissue, and the dizziness will eventually rob you of your independence. You are risking your entire quality of life on a misdiagnosis. For a fraction of the cost of endless, useless ear tests and sedating medications, you can have an elite neurosurgeon review the structural mechanics of your neck, potentially identifying the false alarm and giving you your balance back. If this video helped you understand your pain, please click subscribe. It allows us to keep providing free, elite medical education to patients worldwide who cannot afford a neurosurgeon. You are watching this video because you are looking for a real solution. But you cannot fix a mechanical spinal problem by guessing. And you cannot fix it by asking questions in a comment section. If you have an MRI or X-ray of your neck, do not just read the paper report. Every spine is unique. Click the link in the description to upload your imaging to our secure portal. Our neurosurgeons will personally review your scans, hunt for the hidden signs of cervical instability, and build your personalized, minimally invasive treatment plan. Stop living in fear of falling and stop treating the wrong anatomy. Let us find your solution today.